surgery is very safe. Tens of thousands of people have laser surgery to get rid of glasses every year in the UK, and there are very few people that do have complications or risks from laser eye surgery. If we're talking about LASIK, which has a flap in the cornea, then the main risks or some of the main symptoms afterwards, dry eyes can affect some people, not a lot of people, and people aren't generally affected badly by it. Although if you were to Google LASIK ruined my life, you would find a group online of people who do not like LASIK, and mainly I think they're suffering from dry eyes, but they're very, very few and far between. I've been doing laser refractive eye surgery for over 20 years, and there are really very few people who have persistent problems with dry eyes from LASIK. If people have dry eyes with contact lenses, that doesn't mean to say they're going to get dry eyes after LASIK. They may be using teardrops after the month of teardrops that they routinely would have after laser eye surgery. They may use teardrops come months 2, 3, 4, and 5, but it'll gradually get back to hardly using the drops at all. Glare at night is something that worries a lot of people. Again, glare is there initially, but it settles down over the following days, weeks, and even months in some cases. But on the whole, not a lot of people come back complaining of glare at night. And certainly in the UK, a lot of winter is very dark with headlamps and street lamps, and not a lot of people seem to have persistent problems with that. With the LASIK flap, the one with the flap as opposed to the surface PRK, again, the flap can be injured later on in life. So for people who are going to join the armed forces, or for people who are boxers or do a lot of contact sports, we tend not to recommend the LASIK with a flap, but recommend surface PRK, because the flap can introduce a whole new set of potential problems. But even then, it's very rare to get people who have injured the flap and dislocated or dislodged the flap and needing to have it returned, or who get sharp injuries to the cornea that result in flap shifting. Apart from that, those are the main kind of issues with LASIK. The chances of not completely treating all of the short-sightedness or long-sightedness and needing a can be in the region of 3, 4, 5%, depending on what your pre-laser refraction is like. You've got astigmatism, you're perhaps a lot of astigmatism, you're more likely perhaps to need a refinement. If you're a high myope, you might perhaps need a refinement later on. But even then, these are small percentages. Some people say, is it instantaneous? Does it work right away? And certainly, by the end of the day, you'll be watching telly. There might be a bit of dryness, there might be a bit of glare around light, but that will settle down over the next few days. But with LASIK, with the flap, it is pretty instantaneous. The PRK, the surface treatment, takes a lot longer to heal, but that is not instantaneous. But if we're talking LASIK with a flap, then it does heal, and the return to vision is pretty instantaneous. You can sometimes lift the flap and do a little bit more treatment and put the flap back down again in the first few months after laser eye surgery. If many years have passed by, whilst it's still possible to lift the flap and do more treatment, that increases the risk of epithelial ingrowth. That's the surface cells very underneath the flap. So we tend to do a surface treatment into the surface of the cornea if it was to be a retreatment or an enhancement many years down the line. There's no age limits for LASIK. I say that, but we tend to wait for the refraction to be stable. For most people, that's 18, 19, 20, 21, 22. Just when adolescence and the body changing has all pretty much shifted and things have started to settle down and stop changing. The same is true with the eyes. So we tend to wait for the eyes to be stable for at least 2 to 3 years before doing laser eye surgery. So therefore, it tends to be people 21 years and over. When people get into their 50s, 60s, 70s, they can have LASIK, and we still do LASIK sometimes for those people. But often they enter the realm where lens surgery is a better way to treat refractive error, and it's a more stable way, because once the lens has been replaced and a new lens implant put in, just the same as with cataract surgery, things tend to remain pretty stable forevermore. I work at Moorfields Eye Hospital, and Moorfields set the prices, and it's pretty much around £4,000 both eyes to have the laser eye surgery done, and that includes all the follow-up afterwards and any retreatments that hopefully won't be needed, but if very rarely are needed, that includes all that. I don't know how much other places charge, but the Moorfields Eye Hospital tend to keep themselves competitive, but they set all the charges for us.